How to treat and cure bipolar disorder. The exact causes of bipolar disorder are unknown. While genes and life stress may contribute to it, experts believe that symptoms may arise from a problem with nerve circuits and areas in the brain that control emotion, thinking, and behavior. The best treatment for bipolar disorder is often a combination of medication and counseling. Other treatments such as electroconvulsive therapy, ECT, are often successful for people with very severe symptoms who don't respond to traditional therapy or who can't take the medications. Doctors sometimes treat the mania symptoms of bipolar disorder with one set of drugs and the depression symptoms with another, although some mood-stabilizing drugs are effective at treating both kinds of symptoms. Certain drugs are also used for maintenance to maintain a steady mood. Antidepressants are usually not used alone because they sometimes cause manic attacks in depressed patients, and they may be less effective for treating bipolar than unipolar depression. Many people respond well to medications for bipolar disorder. For many others, the symptoms do not completely disappear despite therapy. The mood symptoms may become less intense and more manageable, however. Remember, getting your diagnosis should come as a relief. Now you know what the problem has been and you're on the road to getting the right treatment. Mania in bipolar disorder. If you are suffering from bipolar mania, your doctor at first may treat you with an anti-manic mood stabilizer. Sometimes also an antipsychotic drug and/or a benzodiazepine to quickly control hyperactivity, sleeplessness, hostility, and irritability. Mood stabilizers treat manias or depressions without causing symptoms to swing the other way. Some also may help to reduce the risk of suicide. They are usually taken for a long time, commonly for many years. Treating bipolar mania often requires hospitalization because there is high risk for unpredictable, reckless behavior and non-compliance with treatment. For people with extreme mania, pregnant women with mania, or those people whose mania can't be controlled with mood stabilizers, doctors sometimes also recommend electroconvulsive therapy, ECT. Mania in bipolar disorder. If mania occurs while you are on maintenance therapy, your doctor may simply change your medication dose. Or you may start taking an antipsychotic drug or a second mood stabilizer to lessen symptoms. Also, antidepressants should usually be discontinued while someone is manic, because they can worsen the symptoms of mania. Depression in bipolar disorder. Treating bipolar depression is controversial and challenging. Studies have shown that antidepressants may be less effective in treating bipolar depression than they are in treating unipolar depression, that is, major depressive episodes in someone who has never had a previous manic or hypomanic episode. Also, using antidepressants alone may trigger a manic or hypomanic episode in some people with bipolar disorder. Treatments. Depending on your needs, treatment may include initial treatment. Often, you'll need to start taking medications to balance your moods right away. Once your symptoms are under control, you'll work with your doctor to find the best long-term treatment. Continued treatment. Bipolar disorder requires lifelong treatment, even during periods when you feel better. Maintenance treatment is used to manage bipolar disorder on a long-term basis. People who skip maintenance treatment are at high risk of a relapse of symptoms or having minor mood changes turn into full-blown mania or depression. Day treatment programs. Your doctor may recommend a day treatment program. These programs provide the support and counseling you need while you get symptoms under control. Substance abuse treatment. If you have problems with alcohol or drugs, you'll also need substance abuse treatment. Otherwise, it can be very difficult to manage bipolar disorder. Hospitalization. Your doctor may recommend hospitalization if you're behaving dangerously, you feel suicidal, or you become detached from reality, psychotic. Getting psychiatric treatment at a hospital can help keep you calm and safe and stabilize your mood, whether you're having a manic or major depressive episode. Medications and pregnancy. A number of medications for bipolar disorder can be associated with birth defects. Discuss these issues with your doctor. Birth control options, as birth control medications may lose effectiveness when taken along with certain bipolar disorder medications. Treatment options if you plan to become pregnant. Breastfeeding, as some bipolar medications can pass through breast milk to your infant. Psychotherapy. Cognitive behavioral therapy. Psychoeducation. Interpersonal and social rhythm therapy. Electroconvulsive therapy. Transcranial magnetic stimulation. Mood stabilizers. Older medications, such as lithium, which are reliable and well tolerated by most. Once the first-line treatment for bipolar disorder, they have largely been supplanted by atypical antipsychotics. Treating bipolar disorder. Treatment for bipolar disorder aims to reduce the severity and number of episodes of depression and mania to allow as normal a life as possible. Treatment options for bipolar disorder. If a person isn't treated, episodes of bipolar-related mania can last for between 3 and 6 months. Episodes of depression tend to last longer, for between 6 and 12 months. However, with effective treatment, episodes usually improve within about 3 months. Most people with bipolar disorder can be treated using a combination of different treatments. These can include one or more of the following: medication to prevent episodes of mania, hypomania, less severe mania, and depression. These are known as mood stabilizers and are taken every day on a long-term basis. Medication to treat the main symptoms of depression and mania when they occur. Learning to recognize the triggers and signs of an episode of depression or mania. Psychological treatment, such as talking therapies, which help you deal with depression and provide advice on how to improve relationships. Lifestyle advice, such as doing regular exercise, planning activities you enjoy that give you a sense of achievement, and advice on improving your diet and getting more sleep.